Good morning, one and all. The hearing will come to order. We want to welcome all of our witnesses. Thank you for joining us today, for your preparation and your willingness to respond to our questions. Today's joint, we don't get to do this every day. I'm delighted to be here with our friend Senator Tom Udall. And we're going to have this joint hearing today to review the impacts of air pollution on children's health in the United States of America. Our senators will have roughly 5 minutes for their opening statements. I'll then recognize our panel of witnesses, and we'll ask each of you to use about 5 minutes for your opening statements, too. Your entire statements will be made part of the record, so if you could summarize and try to keep within that time constraint, that would be good. And after the panel's statements, we'll have maybe 2 rounds of questions. Well, we're reminded today as the temperatures approach 100 degrees here in our nation's capital that summer is here. And that means kids, I don't know today, kids outside swimming, well, there's a swimming pool around, they'll be there, but playing baseball and eating barbecue on the patio, maybe inside in the air conditioning. But in many parts of our country, summer also means smog and exposure to deadly air pollution. The summer smog season, also known as the ozone season, is a powerful reminder of how important it is to have clean air to breathe. Smog causing air pollution from dirty power plants, from automobiles and other sources is linked to serious health problems like asthma, like strokes, like heart attacks, and even early deaths. Smog is especially dangerous, as we know, for our children. Parents who have watched their kids with asthma suffer on high ozone days know this better than anyone, and some of them are here today. Unfortunately, smog is not all we have to be concerned about when it comes to our children's health. Millions of our kids ride a bus to school, play on a playground, or live in a community that exposes them to high levels of ozone, to particle pollution or air toxics, all of which can severely impact children's health. In fact, nearly all air pollution is more dangerous to our children than to their parents for 3 primary reasons. And 1, the immune systems of children are still developing. 2, they breathe in more air in proportion to their body size than do their parents. And 3, they're more likely to be outside for longer periods of time during the summer, exposing them to more air pollution. As a parent myself of 2 boys, now grown, I've spent a lot of time worrying about our own children's health. As a U.S. Senator, I also worry about every child's health. And that's why I've worked hard with my colleagues, Democrat and Republican alike, to make sure that all of our children have clean air to breathe, air that's free of all types of air pollution. And we've made remarkable progress in cleaning up our air, especially in some parts of our country. But if truth be told, we still have a long way to go in many other parts of America. More than 7 million American children have asthma, including nearly 28,000 in Delaware. Childhood asthma rates are still rising. In fact, in Delaware alone, each of our 3 counties received a failing grade from the American Lung Association for the number of high pollution days they have experienced. And for me, that's more than just disappointing. It's almost heartbreaking. I'm not too old to remember that one of the great things about being a kid, especially in summer, was getting to run and play outside. In fact, I still love to run distances with my oldest son, 22 years old. And even though he runs me into the ground, few things are better than that. But kids with asthma get left behind on poor air quality days. And frequently, they have to give up fun as well as healthy exercise. They often have to restrict their most basic daily activities. Moreover, those kids may have to miss school. Their parents may have to miss work. And all the while, healthcare costs in America, already the highest in the world, continue to rise. Those costs add up to trillions of dollars lost every year in this country. That's not millions. That's not billions. That's trillions with a T. The Environmental Protection Agency is now considering what I think are sensible rules to reduce smog-causing pollution, as well as particle pollution, mercury pollution, and other harmful air toxics. For example, recent air toxic regulation for utilities would limit emissions of known toxics that affect the development of a child's brain or nervous system or affect the way a child's body develops. These rules can give us all cleaner air while reducing those pollutants that will help prevent a wide variety of serious health threats to our children. And in the end, we stand to achieve better health care results for less money. That's right, better health care results for less money. It is my hope that today's witnesses will provide us with new information and insights on what our federal government is doing well and maybe what we're not doing so well, so that we can enhance the quality of our nation's air and protect the health and welfare of our systems, especially our nation's children. 5 minutes on the money. All right. Senator Udall, match that.